Hello and welcome to this episode of the Anna Asks podcast. I am your host, Anna Cusack, and as part of this season 5 of our podcast, I'm interviewing a whole range of guests around their pregnancy, birth, and postpartum plans. Today I'm speaking with Hayley Worth, Dr. Hayley Worth from Sydney, and our interview is going to take a little different form compared to some of the others you might have heard previously in this series because, as you may be able to hear in the background, her baby's actually already arrived. So we started having this conversation or planning for this conversation when Hayley was quite far into her 3rd trimester already and just decided to take the pressure off. We might do this in that 4th trimester period instead. So this might give us a different view on that time of life. So a huge welcome to you, Hayley. Hello.
Hello, and thank you so much for having me.
Oh, it is such a pleasure. I'm very pleased to have you and your personal experience and professional expertise shared on this podcast. So before I get you to introduce yourself properly, I would just like to acknowledge the traditional custodians of the land on which we are each recording this podcast. So for me, I am up here in Lake Macquarie area, in beautiful Awabakal country. And where are you, Hayley?
So I'm in the south of Sydney, which is Dharawal country.
Beautiful. Thank you very, very much. Now, we can hear your little bub in the background a tiny bit. It's a very cute sound that will continue with us through this episode, I think. But would you be able to introduce yourself and perhaps who's in your family as well?
Yeah, so hi everyone. My name is Hayley. I am married with a 3-year-old daughter and a little 3.5-week-old baby boy, and this is all very, very new and big for me to now have 2 children. It seems crazy. Professionally, I am a doctor, so I initially trained as a GP, and then I decided that I wanted to broaden that. So I also have a second specialty. I also work in palliative care. So I devote half of my time to palliative care and half of my time to working as a GP in the emergency department, and I work primarily with children.
That's quite a spread of expertise and interest areas that you bring. What drove you to enter that kind of work and particularly to focus on children?
Yeah, it is. It's really unusual. I don't think you'll meet very many doctors who have that kind of really unusual kind of both ends of the spectrum, but it really works for me. So essentially, I wanted to work in an area or areas of medicine where it's very patient-centered and like holistic. A lot of medicine, although well-intentioned, ends up being quite kind of fast medicine where you don't really focus on the patient and their family and their whole needs. Working with children, you have more of that focus, and of course working in palliative care as well. I particularly love working with children because there is so much potential when you're working with children. You're treating not only the child, but you're also managing their family as well, and trying to help their family and their parents deal with whatever challenges may be coming their way. So to me, that's just such an inspiring part of medicine.
Given your professional work in that area, do you feel that you were prepared to have your first baby 3 years ago for what life would actually be like, or being on the side of the fence as the parent rather than the doctor, did it throw you some curveballs?
I can say definitively I was not prepared. There's only so much, academically, or clinically that prepares you for the actual kind of, real life experience of what being a mum or what being a parent is. Maybe from a medical point of view, like I knew what features of illness to look out for. I knew, kind of the medical features of birth and things like that. But being an actual parent, I don't know if anything actually prepares you for being an actual parent. So it was a big life change for me, and I'm more than happy to acknowledge that. I don't think I really knew what I was doing until I became a parent.
Yeah, I've heard that across people from multiple health disciplines actually, and it started off that it surprised me because I thought, oh, you would have seen this situation so many times before, but until you're in it 24/7 and experiencing that, I suppose the whole identity shift that goes with it too. Yeah, it's a separate thing.
Yeah, I could not agree with you more. There's nothing like actually being in that situation. And I guess just going back to what in particular drove me to work with children, the other part, apart from it being a more kind of holistic space perhaps than other areas of medicine, because with children you're really focusing not only on their, whatever acute reason, acute illness or acute presentation that they've come into you with, but you're also focusing on their long-term growth and development as well, and maybe try to help them achieve their potential. But it's also one of those spaces where there's so much room for better engagement and better connection with the child and with the parents. Like, I think as a whole, as a society, as doctors, as healthcare providers, we can do so much better in how we engage with children and with their parents, especially with their families, because there's just such a lack of kind of good information going out there to children and parents, I think.
Yeah, that's a really interesting thing to say, because I suppose more often the engagement that I have with doctors as a parent is only if my child needs care or support at that time and I'm after some advice or prescription or whatever it is.
Yes.
Whereas the side that I see and hear more about is the pregnancy care, birth, maternity kind of systems. And I feel like the information given there can be quite inconsistent as well. And how these things kind of flow in together, because that pregnancy and birth care is not necessarily supportive, there can often then be a justified level of uncertainty or distrust in the care that follows on from that. And so for somebody like you who's really looking for the long-term outcomes as well as the acute problem that's in front of you, then that's a really important position that you feel as well.
Absolutely. And trying to rebuild slowly some of that trust that may have been lost is so, so important.
So given that this is your second child and you had quite that eye-opening experience the first time around, did you approach some of these aspects around pregnancy or birth or preparing for postpartum differently for your second as opposed to your first child? Or perhaps what did you think, what kind of things did you think about that may have been prioritized for you compared to like our normal cultural model, which is just kind of like, oh, we'll soldier on, we'll just make it up as we go along and we'll get through it?
Absolutely. I think I did approach it quite differently this time around. How I approached it the first time around was I didn't really know what I was going to experience or how I was going to experience. So I kind of just had a pretty easygoing, I'll just, a bit like what you said, I'll just see how things go and I'll just kind of take it out as it comes. And I had a bit of a pretty rough pregnancy both times around. And I think the first time around, I kind of tried to push through it a bit more than I should have. I was kind of reluctant to take medications for my morning sickness and I was trying to kind of just be tough and be strong. And then same with the birth itself. I was like, I'll just see how I go kind of without pain relief. And that ended up for me personally being very, very challenging. I had a very challenging experience with breastfeeding first time around. So I had, unfortunately, really horrible mastitis and infections like recurrently, which was really just horrible. And my mental and emotional well-being, as well as, of course, my physical well-being really suffered as a result. And then I also had problems with a very, very difficult sleeper. So I kind of just had like the full whammy, unfortunately. And so I guess with that in mind, it made me realize just what my limits are. And I mean this in the kindest way possible to myself. I'm not trying to be, self-deprecating, but my limits are very low. So for me, acknowledging that my limits are very low, it actually helped me to accept that I'm not some sort of a superwoman. I'm not some sort of a incredible, female achiever who can do all these things for her children plus more. I just can't do that. And I totally acknowledge that now. So for me, this time around with my pregnancy, I was like, you know what? I need medication for my morning sickness or my reflux or whatever it is. I need it. So I'm going to take it. For my birth, I was like, there's no question. I'm just going to have an epidural from the start and not stress out about that. And that went really well. And then for breastfeeding, I said to myself, you know what, if I need medication to increase my milk supply or if I need an expensive probiotic to reduce mastitis, I'm just going to go for it and just stop kind of putting myself below everything and everyone else at the risk of my own kind of well-being. And that so far has been a really, really helpful and healthy approach for me. And obviously everyone's approach has to be different, as you said at the very start. But for me, just knowing and accepting my limits has been really, really helpful.
I imagine that experience of realizing where your limits and tolerances are may have been quite humbling, because medicine's a very competitive field. Like, you would have been pushing for achievement and positions and studying for some really difficult things over, a decade plus. And then this small person arrives onto your chest and that whole image of yourself gets turned upside down.
I think you couldn't be more accurate in what you were saying. I think it comes not only from like kind of professional background, but also as a society. We have such high expectations on women. It doesn't really matter what career or not career, you have chosen in terms of your life path. I think we just put such high expectations on women for, what they should be able to achieve. If you're strong enough, then you should be able to do this. And, why is this mum complaining about sleep deprivation? Or why is this mum complaining about breastfeeding difficulties? Women have been doing this for thousands of years. It shouldn't be a problem, blah, 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 blah. And I think we internalize that so much. So even though I didn't think I had internalized it, I think I definitely had internalized it. And so that, in combination with what you're saying, that kind of expectation of being able to achieve, as long as you put your head down and you work hard enough, you should be able to achieve it. It's completely unrealistic. Birth, pregnancy, all of that, just having a newborn, having a baby or having a toddler or whatever, it turns all of those things completely on their head, whether you want it to or not.
Yeah, because parenting a small child is not the same as studying for an exam. It is not the same as going, if I just work harder and I learn this exact chemistry process and I'll get all the pieces right, and then I will have reached the end goal and I will submit it and we will have no problems with this forevermore and we'll move on to the next stage or subject or whatever. No, it is a whirlwind, a roller coaster, an up and down flux, whatever image you want to use. It is very much not linear. So
absolutely.
And our society is so structured along linear achievements, linear progression, everything going on, nice chronological order of improvement. And that's just not right in this context. It just is not relevant at all.
Absolutely. And the flip side of that, I think, just in my limited experience, is that when something's not going right, it's often reflected back on the mum or the parent.
Yes.
But, more often the mum. So, well, what's the mum not doing right? That her breastfeeding isn't going right, or that, her experience of this isn't going well. What's the mum? Oh, the mum just isn't coping. How often have you heard that? The mum isn't coping,
Yes.
I just think that's a terrible way to look at things.
Yeah, and there's a woman up in Newcastle here that I work with often, and she speaks about her firstborn, who it took until many, many months, maybe 12 months or so, until the daughter was diagnosed with something that was really affecting her feeding and her sleep. And during this time, the mother had so many different doctors saying, you just need to take these antidepressants. And she's saying, no, there's an issue here and it's not with me. Yeah. Maybe I am depressed, but it's because none of you are listening to me about this.
That's exactly right.
And I know in some of her work, sociologist Dr. Sophie Brock talks about how the mothers are often dismissed time and time again, but then when there is an emergency and they bring their child to someone like you in the emergency department, that's when the mother becomes this valuable source of information where they can tell you if this is or isn't normal for their child. But along the way, they've kind of had that expertise undercut time and time again in relation to whatever behaviour their child is displaying, whether that be in a social context or an education context or whatever.
Yeah.
We need to be extending that same respect that parents are afforded in an emergency setting to their whole child raising experience, to actually change how we experience our motherhood and parenthood in our culture.
Yes, absolutely. Yeah, and just constantly seeking to support and validate. I mean, it's I guess it's such a tricky balance because you're trying to perhaps assess a child and reassure the parent that no, this is normal, and the child's feeding is normal, or the child's I don't know, skin or whatever is normal. But there are ways of doing that which invalidate the parent, and there are ways of doing that that validate the parent.
Yes.
You can choose how you communicate.
When it comes to your own current postpartum experience, you would have a fairly good awareness of what resources and supports are around for new parents. You've spoken about your decisions or your thoughts about perhaps using medication that you pushed away first time around. But in terms of practical support services, what kind of things have you either got in your toolkit for if you need them or engaged with already?
Probably my primary concern this time around was that I was going to have similar or the same challenges with breastfeeding. So I looked into a lactation consultant, so actually a GP who specialises in being a lactation consultant in my area. So I had a consultation with her before I gave birth, so in my late third trimester, and kind of brainstormed ways that I could address issues that arose that were similar to last time. I also was aware that the hospital that I was giving birth at had a lactation consult service available as well. So I just wanted to kind of have as much lactation support available as possible. And so that would be probably the main professional resource that I called on for that. And I also just spoke to my GP and said, look, these are the issues I had. What would you say would be okay for me to do in terms of seeking medication support and things like that, and got his okay for that as well. And then I guess other professional resources that I know I can call on this time, which I left far too late last time, are support with sleep. So last time, as I said, I just kind of battled through. My daughter, this does not undermine our relationship at all, but she was an absolute dreadful sleeper. So, and I left it months and months of just the most terrible fraction sleep until I finally reached out for help. So this time around, I know I can reach out for that help earlier if need be. And then I guess personal resources, the investment in having a cleaner come to our house every fortnight, which just makes a world of difference. I think cleaners are just worth their absolute weight in gold. And I've also switched to online deliveries of pretty much everything. So those are two things that I did not do with my daughter. I didn't have a cleaner, and I didn't have online deliveries, and that's just made kind of my resourcing a whole lot more efficient, I think, this time around.
Yeah, it's just anything that you can do to take the pressure off.
Absolutely.
And I love that you are a GP and yet you've sought the advice of 2 other GPs. I think that's a theme that's coming through in this podcast, is that everybody who is a doula is having a doula. Everybody that I speak with who supports others with their perinatal mental health, they're doing the same. Like, they're engaging the same kind of support for themselves. And so sometimes when we enter motherhood, parenthood for the first, second, third time, unless we are engaged into a network of professionals around us, we can think, oh, everybody's soldiering on. Why can't you just doula yourself, is a question that one of the other doulas was asked. And it's like, well, it's a little bit different. It's a little bit different.
Oh, I couldn't agree more. I think you absolutely have to. Yeah.
Having mentioned as well that you sought a GP who specialises in lactation support, was it Dr. Eliza Hannam that you went to see, or somebody different?
Actually, it was Dr. Melanie Mapleson, who's in the south of Sydney, but I'm very familiar with Eliza as well.
Yeah, so she has done a podcast episode recently on the Tales from the Fourth Trimester podcast.
Yes.
With Naomi Chrysolakis, and it is an hour and a half of just breastfeeding gold wisdom. So if that's something that you feel like you would like to upskill in before your baby arrives, or perhaps your baby's here already and you want to learn more, I would jump across to that and go and have a good listen, because it's going to give you a lot more information than I think the standard hospital breastfeeding courses do, basically.
Yeah, and the standard hospital courses give you next to no information. So.
Yeah, and interestingly, in that episode, she talks about how little breastfeeding and lactation education GPs get, or other other specialists get unless they have a specific interest in it themselves to go and follow it up personally. So go and listen to what Eliza's got to say, and I'm very thankful that Dr. Mapleson was able to help you along your path so far. Has it been easier this time?
Thank you. Yes, so much easier. Just poles apart, and that's not, I know that some listeners might think, oh, that's probably because they're different children, and look, that's a fair observation, but it wasn't actually. My daughter actually was a good feeder. It's actually genuinely the issues were kind of intrinsic to how I was attaching and to kind of my methodology and so forth. And by the way, this isn't in any way, saying to self-blame. It's not. It's just that I genuinely didn't really know what I was doing.
Yeah, we live and we learn.
Exactly. That's exactly right.
But yes, your journeys can be very different with two different babies. So even if one time around was horrendous, it doesn't mean that you have to wipe it off the table if it's something that you would like to try for a second or third time.
Yes. And I think that the biggest thing for me, which is the proof is in the pudding, as they say. And for me, the proof is that my first time around with my daughter, although I continued, I persevered, I pushed on, I never ever, the whole kind of 14 months that I breastfed her, I never actually really enjoyed it, which is a terrible thing to admit that it was true. Whereas this time around, 3 weeks and I can already say, oh, I'm actually enjoying it, which is so nice.
Yeah, I'm going to ask you if you think back to what around this 3 or 4 week mark with your first would have been. How are you feeling now in comparison to them?
Oh, I think my mental and emotional well-being is 1,000 times better than where it was, without a shadow of a doubt.
Preparation can make a big difference.
Yeah,
so
absolutely.
Hayley, if anybody is listening and wanting their experience to be different, either to their first time or what they sort of see as normalized motherhood done in isolation, what advice would you give them?
I can think of 3 key points that would be what has helped me. Now, everyone is different, so of course you've got to take my advice with a grain of salt. This is just what has been helpful for me. First would be knowing and accepting your limits. So what I was going back to, if you are an incredible, powerful, fighter woman and you know that you can put up with any pain under the sun, then so phenomenal. If you, like me, have an allergy to pain, then that it's okay to know and accept that, and to know that you might need to do things a little bit differently. That is so fine. It's not just about pain, of course. That's just one example. Knowing and accepting your limits with sleep deprivation is another example. Or knowing and accepting your limits with with what you kind of need from people around you. My second piece of advice would be to try, and this is keyword being try, not to internalize society's expectations on what you need to do in order to have like a good pregnancy or a good birth or whatever it is. A good birth or a good pregnancy is between you, your baby, your partner, your healthcare provider. It's not for others to judge whether you've had a good pregnancy or a good birth. It really is, all about what your experience is. So if your idea of a good birth is having, a safe home birth, great. If your idea of a good birth is having a planned C-section, great. Try not to internalize what others' expectations are of that. And my last bit of advice, and I think this is something that I would really emphasize, is try not to, when you're looking for kind of advice around yourself, whether it's your pregnancy or your birth or your baby or anything like that, try not to be too overwhelmed and bogged down by all of the anecdotal advice that's out there, especially on social media. There's so much anecdotal advice out there that I think can be, at the very least, it can be quite misleading, and sometimes it can even be harmful. It can really frighten women, or it can, opposite, it can unintentionally kind of reassure women or mums, I should say mum, it doesn't have to be a woman, it can be a mum or a parent or whatever, about say if they're worried about their child and, they read something that kind of actually reassures them, but they should perhaps be worried about their child, things like that. I think you've always got to remember that anecdotal evidence is just that, or anecdotal experience is just that. It's anecdotal. It's so important to trust your experience, whether it's with yourself, with your pregnancy, with your birth, or with your young child. And if you're worried, please do seek advice from a professional who you trust rather than, I guess, relying on anecdotal advice.
Such good advice. Thank you for summarising it there, Hayley. I really appreciate you coming onto the podcast, particularly while you are doing the double shift of talking to us and caring for your little one at the same time. I know there will be listeners who will have got a lot out of this. For those who would like to follow along with both your medical expertise and your personal journey, is there some way that we can find you and connect online?
Yeah, absolutely. I'm just on Instagram under Dr. Hayley Worth. You're always welcome to send me a message if there's something more kind of specific you want to hear about, or if you want, if there's some sort of topic that you want to hear about. I'm very, very happy to communicate with your listeners, of course.
Beautiful. Now, obviously, you can't give personalised medical consultant advice
That's right.
through there, but you can discuss some topics. So if there are any topic requests, I know you address those quite often. So thank you once again. All the rest for the remainder of your immediate postpartum period and this ongoing transition to mother of two, which is something that takes a much longer time than just a few days to fully reveal itself and integrate itself into your psyche, I'm sure.
Thank you so much, Anna. Thank you so much for having me.
Thanks so much for listening. If you love this episode of Anna Asks, it would be a great help if you pop across and leave us a 5-star rating or review. This helps other parents and people to find us and join in the conversation. You can also become a sponsor of this pod for $2.99 Australian a month via the link in the show notes, or head to my website www.annacusack.com.au to grab my free postpartum preparation e-guide, check out my services, or grab my book, Mama You're Not Broken. Until next episode, bye from me, unless of course you want to come chat via socials at Anna Cusack Postpartum before then. See you soon.